Good morning, good afternoon, and good evening. It's Way T Lightheart from Bioptimizers with another edition of the Awesome Health Podcast. And I'm so excited today because we have a wonderful guest returning. It was one of our more popular guests on the podcast, as you might imagine. Our guest is going to talk about empowering patients to take control of their health by addressing their lifestyle and preventing disease from happening in the first place. So Dr. Gupta is a consultant heart specialist in York, UK, who believes in high-quality, reliable, jargon-free information about health should be available at no cost to everyone in the world. He wants people to stop being fearful and anxious about their health by getting them to focus on improving their quality of life and living fearlessly. Born in Zambia and raised in Kenya, his specialty interests include all aspects of non-invasive cardiology and imaging. And you can check out his episode of Keeping Your Heart Healthy in episode 55, which was just a wonderful experience. And Dr. Sanjay Gupta, welcome back to the show.
Well, thank you so much for having me. I'm delighted to be called back.
Yeah, and I have to notice since our last one, you got a little beard going on there for all our YouTube, looking a little bit more of the sage. How has things been for you during this whole pandemic, COVID kind of responsiveness? There's so much concern, and it's very hard to find sources of information. Of course, all the regulations that have been implemented to the population. How have you been keeping during this time?
Yeah, it's been a time like no other, both on a personal level and in terms of what I see at work. I've seen some of the sickest people I've ever seen, so the virus is very real and very, very, when it strikes, it can be really bad. I mean, some of the people I saw, it was like going into a completely different world. You see blood tests, which are so extraordinary compared to anything else you would normally see. And you see a ward full of patients who are just gasping away. Scary stuff. I was fortunate that I actually contracted the virus in March, and I had a mild flu-like illness, and I recovered after that. And that left me with a degree of kind of confidence, and that because I'd had it, perhaps I was less likely to get it again. So I didn't feel the kind of fear that a lot of people who had never had it felt. But sure, I mean, both on a professional level and a personal level, it affected us. It affected me, my family, my friends. Yeah, and I don't know where it's heading. I don't know what's going to happen next. And UK was very proactive in getting the vaccines out, but we are now talking of a possible third lockdown. And that's all a worry because, to my mind, where does it end? How many times do people have to be inoculated? What are the long-term consequences of this? No one knows. These are very, very unpredictable times.
Yeah, I think that's one of the interesting components because I have members like friends and associates in the professional class on the medical side, on naturopathic medicine side. Then you have the people who are kind of indoctrinated by the mainstream media. And then you have people who are kind of on the alternative non-legacy based medias. And unfortunately, it becomes increasingly difficult for people to make educated decisions, especially when there's so much fear. And I have seen, as you indicated, I have professionals who have literally witnessed people with the more extreme cases of COVID, and it's pretty nasty for people. It's shocking, it's devastating, it's very fearsome in its approach. And then there's such a variance, it seems, between some people get it, I didn't feel too bad and that was fine, and then these other people that are literally dead in very short periods of time. And then now we're rolling out vaccinations across the country, and then that's implemented political stuff. As someone who is really tied into particularly preventive care in the heart-based area. And of course, this primarily, if I understand correctly, is attacking at the blood cells and oxygen carrying capacity. This is why people can't breathe properly. And you might be better versed to kind of explain it in layman's terms to people. How does somebody navigate this world as both as a professional such as yourself? We have a lot of professionals that are listening, and then also as just a layperson like myself, who is I'm bombarded daily with, I mean, the whole cornucopia of opinions and ideas, and it's very hard to sort out the wheat from the chaff. How do you do this as a professional in your area?
It's very difficult to try and distinguish between what is true science and what is coming out of a scientist's mouth. And they're two different things. So everyone sort of equates whatever the government says. The government will say, look, we follow the science. Actually, no, we follow what the scientist says.
Right.
That's and that I think is really important to distinguish. The science, the reality is this is a very new condition. It takes years and years and years for us to be able to understand something. It takes years and years for us to accrue the data regarding what works. This is in our hospital in particular. Initially we were told you have to be 2 meters apart from each other. Then they just turned around one day and said, oh, no, 1 meter is fine. We're following the science. Actually, I don't think anyone suddenly started doing these studies and proving this. What I have personally realized that the best way to deal with it is to keep yourself safe. As long as you keep yourself safe, you're doing the best you can for yourself and everyone else around you. And to my mind, I think there is a lot to be said for keeping your distance, avoiding close contact, and doing the basic hand hygiene, etc. All that I think is really important. I was very interested in the vaccination program because that came across as something which could make a real difference. The problem with that is, where it's very difficult. The elderly population seem to be the population that get hit really bad. Mm-hmm. If there's one thing I've worked out, the older you are, the worse you do. Mm-hmm. The sicker you are, the worse you do. So there's little doubt in my mind that the elderly, when you have a vaccine, whatever it does, should be given that, because they need any kind of protection they can get.
Right. And their run rate to the end is much shorter, right?
Exactly. And they're probably not going to live long enough to notice whether there are major adverse consequences of this anyway, so because of age. But when you come to younger people, you're dealing with something that in general doesn't cause too much of a problem in the younger people. You do hear about cases. There's little doubt that it does affect younger people, but they're very rare in general. And the reason they make the headlines is because they're rare. But the problem there is that you then produce a vaccine which has been hurried. Most vaccines take a long time to produce. You need a lot of data. You produce something like this, you inoculate everyone without understanding what the long-term consequences are. And then we talk about re-inoculating and re-inoculating.
Right.
Those are all, worries for me, because most people, to my mind, who are young, if they catch the virus, in some way they have developed a degree of immunity. Now, regardless of what everyone says, it is my observation, there are very, very, very few people who get it twice. Right. And I've certainly not come across anyone in my own practice who got it once, was okay, got it the second time and died. Mm-hmm. In general, I think that natural immunity that your body produces is perhaps the safest
most superior way. Right? Yeah.
Absolutely, I think so. When the vaccine was being produced, I had concerns in my mind, because I thought, well, look, whoever produces this is gonna, whichever company produces this is going to be huge, right? There's so much at stake financially, as a professionally academic.
The perverse incentives of putting forth
Incentives are
a
great.
government regulated vaccine, which
Yeah.
from all standpoints will give you protection for approximately 6 months, I think is what they're saying, and you might have to re-up it, seems to be indicative that, you know, the likelihood of somebody removing the safety mechanisms in order to get it out certainly outweigh the benefit of being late to the party. If you're looking at large multinational companies who are dependent on the bottom line. So there's a couple of, and thank you for kind of sharing that, because I think it's a really interesting point. There's a couple areas that I think would be really good to tack into. We'll get into blood pressure in a second, but I think this is so much on people's plate, and I'm trying to get maybe some standpoints of how people can protect themselves. Because you said one thing that, you know, older people are obviously more at risk than younger people. Also, the data seems to show that people who are obese are also much more likely to run into complications. So those are two definite indicating components. But what about the people who do seem to have some form of natural immunity? I think vitamin D levels are one that's a very concordant. What are some suggestions that you have for people to kind of boost their natural immunity? Because I'm on that side of the equation, as I'm hesitant to take the vaccine. I haven't taken it. I'm in the middle of the road, although it seems I'm just under 50. So that's kind of middle of the road of where I could run into problems. But I'd rather wait and continue to bolster my own immune system to see, even if I do get it, well, I got a good chance of beating it, as opposed to taking the risk of what could be the complications from, you know, multiple levels of vaccination. It's very uncomfortable because it's cutting my ability to travel or go places. It looks like they're going to implement vaccine passports, which that's a whole quagmire we won't have to get into. But what are you suggesting for people to bolster up their natural immunity?
I mean, you know, the nature gives us the best anti-inflammatories, because really at the core of most disease, most chronic disease, you can do, the better. In fact, we use this principle in cardiac surgery or any kind of surgery. You know, when someone comes for an operation, how do you decide whether they're going to be okay for that operation? And one might think, oh, you can do this test, you can do this test, etc., and that'll give you an idea of whether they'll be able to sustain that operation. The reality is there's nothing better than just asking them what they can do in their day-to-day lives. And actually, someone who says, look, I struggle walking a flight of stairs, is generally going to do badly. Someone who says, I can run around the block twice, is generally going to do fine. It comes down to something as simple as that. So how much activity do you do, and how active you are, and how much you can do without actually having symptoms is a really good gauge to your overall heart health. We know that we often, when we're doing assessments on the heart, we put people on the treadmill, and a lot of the data now points that if you can just do more than 9 minutes on the treadmill, that puts you in a low risk category. So you may have a similarly tight narrowing in your heart artery. Okay, and two people can have similarly tight heart narrowing, so the magnitude of the disease is the same, but the person who can do more than 9 minutes is generally going to do well. The person who can only do 2 minutes is generally going to do badly, even though the magnitude of the disease is the same. I think regular exercises.
I can speak to that directly because my father last year during COVID went through a quadruple bypass. And my dad's been relatively fit his whole life. Works in manual labor, and he was literally out in his backyard cutting down trees. And that evening he was having problems, pain in his shoulder and chest. And my mom eventually got him to go to the ambulance at 2:00 in the morning because he couldn't sleep very well. Of course, he was resistant. And finally he said, okay. They kept him in there. And what had been interesting is he had done these type of tests already earlier that season for his heart disease, and he was fine on the treadmill. He was continuing going. He was still active, very laborious. And eventually, you know, then they looked at him. He had less than 30% of his blood flow. And so then they had surgery with him, and he's up in his 70s. And he had the surgery on Wednesday and was out of the hospital on Friday and recovered in 3 months. And, you know, he's kind of back to his old self again, which is remarkable to modern medicine. And we know a lot of other people might possibly have been dead in that situation. I mean, to think that he was only running on 30% of his capacity. What do you feel when you talk about protecting oneself? And there's a fine, I want to know, as a physician, how do you see protecting yourself from the aspects of the who you're connected with, or social distancing, or all these sort of things, concordant with, you know, the mental health issues that we start to see happening around people not being able to socialize with their friends and their families. And, you know, like, we're seeing that whole consequence, and we know that that has also damaging effects. And I think you're very balanced in your approach. How does someone navigate those things from your perspective? Because, you know, I have friends, their families are fighting ridiculously because some people are like, everybody has to vaccinate. And then some of them are like, no. And they're like, well, you're an anti-vaxxer, or you hate your family. I mean, we're getting into these type of horrible conversations that are just people that I know, that I'm friends with. How do you navigate that as a physician when someone comes in and says, hey, what do I do here?
It's incredibly difficult. I mean, I think I would never quite understand the impact it has on mental health until I am in that position where I am perhaps not as mobile, I'm not as independent, I need my family around me, I'm, you know, so it would be harsh of me to even try and pretend what goes on in people's lives when they get to that stage. And I completely appreciate, and completely appreciate it. And that's why I think that anything that, you know, when you're older, when you're more dependent, anything that gets you out of that is fine, you know. So the vaccine comes along, and if it says, okay, you can get out and you can spend that time with your family, because at the back of a lot of people's minds is, look, you know, I'm not worried about how long I live. What I'm worried about is my quality of life. What I don't want to do is be lonely. What I don't want to do is be isolated. I think it's interesting, and this is why the younger, generally healthier, more independent people will cope fine, both with some of the social distancing, social isolation, but also if they got the virus. The older population, exactly the population who will suffer the mental consequences of being sort of trapped in their house, is the person who's most likely to do badly if they come out. So in that setting, if there is a vaccination program which offers you some hope that you can get out, whatever that means, you know, at least it gets them out, at least it makes them, it's very difficult. But I think what you have to always see is what is important. Is quality of life important? Is length of life important? For an 80-year-old, most 80-year-olds will turn around and say, well, look, I've had a good innings. I'm not fussed about that. I just want some quality in my last few years. And so why deprive them that? Mm-hmm. Absolutely. You know, I think, and that's why it was important to come up with something like the vaccination program, which gave people that hope that it would be okay to go out. We don't know what it will do, because most places where they're doing the program have also been socially isolating. There have been lockdowns in place, and now certainly in the UK, this is going to be the acid test. How do you tease out whether it's the effectiveness of the vaccination program versus the lockdown?
Right.
Now that things are beginning to open up, it would be really interesting to see what happens.
Yeah, it is. And one of the channels that I listen to is Brett Weinstein. He runs a podcast called Dark Horse podcast. He's an evolutionary biologist, and his wife is also a strong I would say, scientific acumen, as they're not prone to sensationalism or politicization of their messages, which is really, really important because it's kind of hard. So much of this has been politicized, used by opposing parties in the political sphere, and it's just really it has no place for that. And that's probably the most dark part of the whole thing is, as you said, we're listening to the scientists, but this scientist has this opinion, this has scientists, and science is about testing hypotheses and debating it out and then coming up with the best solution, as opposed to politicizing and turning that politicized into propaganda, which is making it hard for people who don't have that background to make, informed, educated decisions, so that both people can, like you said, hey, I'm 7 years old, probably a good idea if I get a vaccine. Hey, you know what? I'm 17, haven't had families or kids yet or whatever, and haven't lived on with my life. Probably better to maybe set aside. But, could we have what really should be is scientists getting together and issuing a standing scale of, likelihood, and maybe we'll get to there at some point. One thing that was brought up, and you might have an opinion on it, you might not, in the Weinstein podcast, was the concern that when you start vaccinating in the middle of quote unquote a pandemic, that you may actually accelerate the more dangerous mutant strains by doing so. And this was a virologist that came on. There was a Dr. Bhakti that came on, and there was another, a Dr. Vanderbosch, who both had deep concerns. Their virology stuff. Is there any weight to that? Is there any sense to that? Because I don't know could vaccinations actually accelerate the problem, as opposed to because they said the average virus, you got 18 months. That just doesn't, and it's, despite what we've tried to do globally, it doesn't seem to have stopped it that well. I mean, of course, we don't know what it would have been had we not done that stuff, of course. And then they say it kind of mutates itself and then you get to herd mutality. But with vaccinating populations in the middle of it, you may actually create more resistance or more lethal mutant strains as a consequence, like your overreaction, because it's like, okay, I'm throwing gasoline on the fire trying to put it out. Is there any merit to that? Do you know anything about that? Or
it's very possible. I think the very fact that, to my mind, the more you're vaccinating, the more the variants are beginning to show up, certainly in the UK. I think that's a real possibility. I mean, the problem is we've not been in this situation before, so a lot of what we know about this is from previous experiences, but for a lot of us, this is the first time. So time will tell how things turn out. It's really, really difficult. I don't know. What I do know is that when I was at the beginning of the pandemic, when I was listening to people and they were talking about a second wave and a third wave, and they were talking about we're never going to be normal and we're going to go to the new normal, and all that is beginning to come true, isn't it? When we had the first wave, for us, we were all called to this conference room, and we had the most pessimistic, scary lecture about how awful this virus is going to be and how we're going to be, we're going to have patients in corridors, and actually and everything was shut down and people were being turned away because we didn't want the hospitals to be full and we wanted to create that. And actually it didn't turn out that way at all. And in fact, we were more worried by the end of the number of people who'd missed out on potential care that could have been provided because we decided to close things down to try and accommodate all these patients that were going to.
They were worried that slow the curve was to prevent an overwhelm in the hospital settings.
Exactly, and that never happened. So the first wave, to my mind, was, gosh, well, that wasn't even that big a deal. And then, and you think, okay, well, it's going to fizzle out, and that's it, it's gone. And then we had all the protests. You remember the Black Lives Matter protests after?
Yep, across the United States. Yep.
yeah, across the United States. And that was just happening at the end of that first wave. And actually, we thought, okay, now we're going to see a huge surge of cases. A month later, nothing. And then we thought, okay, well, this is odd. Maybe it has really gone. You know, all these people gathering together, nothing. And then the kids started going to school again, and we thought, okay, well, we're going to see something. And then slowly it started creeping up. And then this time we had a much bigger wave. So, you know, we lost about 40,000 in the UK in the first wave, and then the second wave came along and we lost twice as many more people.
Do you think the third wave will be worse again?
Well, yeah, well, so I've learned that certainly, you know, some of these guys, some of these public health professionals, whatever the advice they were giving, in retrospect did come true. You know, there was a very good, very knowledgeable professor. I'm not sure where she works, but she'd actually predicted this once upon a time, and she'd said, look, you know, the way there's going to be this is someone's going to get something from a meat market or somewhere, and that's how it's going to spread, etc. And she was talking about the fact that, look, you know, isolations, you know, lockdowns don't work in the long term, because as soon as you open things up, things come back, and it all proved true.
Yeah,
so
it kind of delays the inevitable, it seems.
Yeah, so I am convinced that there are lots of people who know exactly what they're talking about. And I think that those people who turn around and say maybe you are increasing the risk of variants is true as well. Absolutely. I do believe that that's very possible.
Yeah, certainly makes for a challenging time, and we'll probably be looking back on this hopefully in 10 or 20 years as what we could have done better and what we did poorly and what we did right. And of course, it's hard to get a unified strategy across nation states, political divides, economic realities, because of course the devastation that's happened, particularly in the lower class of populations around the world, we can't even comprehend just the economic impact and what that's going to result in, particularly in Africa. There's a lot of people, I know the World Health Organization early on doubled the amount of people that they thought would be shortened for food because of supply lines and channels of that. And then, you know, we'll see how the economic reality is, because we've been giving out money and giving out with people out working. So we don't know what all the full toll is going to be, and probably be a decade or so before we even grasp it. Thank you by the way, for just sharing your insights on it, because it's such a dicey topic, and it's hard to kind of navigate that. And I've been, you know, having conversations with my friends and colleagues about this to try and get their 2 cents worth.
Also, one of the other things I was going to just quickly mention is that the big problem with this kind of worldwide vaccination drive is that at some point it will become very difficult to tease out what is due to the vaccine and what isn't. When something becomes so embedded in society, then it's very difficult to do an experiment, like trying to do an experiment on Wi-Fi. Yes, you can do lab-based experiments, but where are you going to find 1 million people who are not being exposed to Wi-Fi, who participate in clinical trial, compare them to 1 million people who have Wi-Fi, follow them up over 30 years? Who's got the money? How do you find these people? And how do you then work out what impact these things have on our long-term health? This is the fundamental problem. The thing is, you know, clearly it is very obvious to me that people are getting sicker. You know, is that food? Is that certain things in the food? But how do you now do those experiments? And the problem is that there is this propaganda I don't think we should ever be in a society where we're afraid to ask questions.
Right.
You know, we should be able to ask questions, and those questions should be answered by properly designed experiments which are geared to answering that question. Unfortunately, that isn't allowed to happen these days, because the minute you say something, you're branded, oh my God, he's anti this, he's anti this, he's this. I think the point is simple, that you should be able to ask the question. There is nothing wrong. And then you design an experiment which tries to answer that very question. That is the way I think it should be. The problem here now is, if you have the whole population, if you have 1 billion people vaccinated, and then we start seeing things like more chronic fatigue syndrome, we see things like more migraine, we see more, all this kind of stuff. How do you know? It's going to be very difficult to tease out.
It is going to be very difficult. And I really am not envious of our frontline care workers, such as yourself, people who are put in these essentially impossible positions that, and I think a lot of people haven't really reflected on this accurately, is that, we trust our physicians to do the heavy lifting, to be able to interpret the data and the research, and to make the best recommendations possible that they can. But it becomes extremely difficult to mitigate the potential variance in this equation. And so you're really left back to the individual to work with their physician to do kind of a risk analysis and make the decisions back on that, and to try not to project that onto other people. And I have this ongoing debate with one of my NDs who's on the front line, and he's helping in the Canadian front provide vaccines. And he has come to the conclusions that vaccinating the population based on the research that he has is the way to go, which surprised me a little bit. So last week we spent 3.5 hours, and he was generous enough to spend 3.5 hours on the telephone as we walk through piece by piece by piece. I don't necessarily agree with him. However, I respect his opinion as a physician, and I go, okay, I understand how you've come to that conclusion and why you're doing what you're doing. I'm going to stay here on the sidelines and keep hitting you up with the various components, and we'll see who wins the bet. And I really hope, I've never wanted to be more wrong in my life, and I hope that I am wrong for my own decisions in my own life and that sort of things. And we'll see how it all shakes out. To move on, because I don't want to dominate this, although this is probably the most relevant conversation. Let's talk about one of the things that my dad is now as a post cardiac surgery person. He had, like I said, a quadruple bypass, and he's in his mid-70s, and he's been doing well ever since. But one of the things that they monitor, and now my mom is monitoring this regularly, is his blood pressure, and saying, hey, we need to look at your blood pressure on a regular basis, particularly if he gets tired or winded or things like that, which we have noticed a difference in him since the surgery, that sometimes he gets very tired. Now, we don't know if that's from detraining, because he was so physically inactive for an extended period of time. It's harder to come back when you're older, or it's because of some consequence of, the post-surgery recovery, whatever it is. Can you explain to people what blood pressure is all about, why a physician monitors that, and what are some of the insights that you can say that people can use this as a tool to monitor their health and well-being?
And now for a Bioptimizers fixed digestion tip, rapid cheat meal relief. Research shows that cheat meals can actually be an effective way to boost your metabolism. One key weight loss hormone, leptin, can be increased by up to 30% following a cheat meal. The challenge with the cheat meals is that all those extra calories and lower food quality can be hard to digest, which means you could be totally sidelined with a food coma after big cheat meals. The solution is to take strong digestive enzymes like masszymes, which will help rapidly digest and break down the extra food. 3 to 5 capsules before or right after your cheat meal can make a huge difference in how you feel following the cheat meal. If it's a cheat day with multiple large meals, you might want to go up to 10 capsules or higher to help you power through all that food. To save 10% on masszymes, go to masszymes.com. That's MASSZYMES.com cheat10.com and enter the code cheat10 at checkout.
Yeah, I think the concept of blood pressure is fascinating, and despite the fact that it's everywhere and all the doctors are, harp on about it, it is so incredibly poorly understood, even by the people who manage it.
Wow.
Patients, okay. And a lot of my understanding has just come from trying to work it through in my own mind. The first thing I would say is, to try and understand blood pressure, we have to understand what pressure is.
Yes.
And pressure is force over a certain area. So if you increase the force over the same amount of area, you get a higher pressure.
Right.
Or if you have the same force over a lower area or smaller area, you increase your pressure that way.
Right.
So in blood pressure, the idea is the force of the blood over the area of the blood vessels. So if you take all the blood vessels, open them up, that's your area, and the force is the amount of force applied by the blood being ejected onto that area. So in some ways, when we think of blood pressure, it is dependent on how hard or how much blood comes out of the heart and the heart rate. And that determines...
That's called the ejection fraction, right?
Yeah, well, the ejection fraction is but I mean, I think so. The ejection fraction just tells you how much blood comes out with one heartbeat,
right?
But it's not an absolute value. It's a fraction. Whereas what I'm talking about is the stroke volume, meaning the actual absolute volume that's coming out of the heart, multiplied by the heart rate, how many times your heart is beating in a minute, for example. So it's a little bit like taking a balloon and saying, well, what dictates the pressure within that balloon? Well, obviously, how many times I blow into that balloon, and how much air I'm getting into that balloon with each breath.
Right. How many breaths do you take to blow the balloon out, right?
So your blood pressure will go up if your heart rate goes up. It'll go up if you've got more volume coming out of your heart. But the other thing that determines blood pressure is the area. And so if you're dealing with a balloon, for whatever you're blowing in, because the balloon stretches, the pressure remains lower. If you did the same thing with a hot water bottle, which doesn't stretch as much, the pressure goes up much quicker. And this is inherently the issue, that our pressures are so dependent on our heart rate, how much blood is coming out of our heart, but also how stretchy our vessels. Pathological blood pressure, so you have physiological blood pressure changes. You get anxious, your blood pressure will go up, your heart rate goes up, etc.
Right.
You exercise, your blood pressure goes up. You're stressed, your blood pressure goes up. However, pathological blood pressure is about the stretchiness of your blood vessels. How stretchy are they? As we get older, they become less stretchy. And because they get less stretchy, the surface area is smaller. And therefore, the pressure goes up.
Right. And so arteriosclerosis or hardening of the arteries is the loss of flexibility inside of these arteries. And the more that loses its flexibility, the higher the blood pressure tends to go up as we age. Is that right? Exactly. Okay.
Absolutely. So you get more of that. And therefore, the important thing to understand is that is the process, which is the thing that is the thing that dictates pathological blood pressure rises, not your heart rate going up. And so one of the most important things to understand is that people have to realize that, okay, well, what is the whole issue with that? Okay, well, if your pressure goes up, what will it do? Well, if you have very fragile blood vessels, as with pressure in any container, if the pressure is too high, it damages the container.
Right.
So if your pressure is too high, then your most fragile blood vessel will burst. And that has two effects. One, because these blood vessels have burst, they will heal by clotting off. And therefore, the organs that they're supplying are not going to get as much blood.
Mm-hmm.
But the second problem is that the size of the balloon gets smaller because these blood vessels have now clotted off. So the pressure goes up, right? Because the balloon has now become smaller, same amount of force, but the area has become even smaller. And so the pressure goes up. And because the pressure goes up, you then have more damage. And then the pressure goes up again and you have more damage. So that's the whole idea behind this.
And is this why typically as people age, they'll start to give them little pills to modulate their blood pressure to keep their blood pressure down? But would that potentially cause other problems of not getting enough blood supply to organs that might not be getting as much blood?
Well, so you're quite right in the sense that if you age, as you age, your blood pressure is supposed to go up.
Right.
Now, the problem here is that what we do is when we start giving people who are just aging naturally and their blood pressure is going up, we start giving them medications to lower their blood pressure. Mm-hmm. So what can happen is you can exaggerate a fall in the blood pressure. And the reason for that is very interesting. Again, it's worth understanding this, because if you think about the difference between blowing into a balloon compared to blowing into a hot water bottle, right? When you blow into a balloon, you're blowing a lot of air, and because it's stretching, your pressure doesn't go up. With a hot water bottle, a small amount of air, the pressure goes up quite a lot. So imagine what would happen is if I take some air out. Mm-hmm. In the hot water bottle, the pressure will go down very substantially. Mm-hmm. Whereas with the hot water, with the balloon, it won't go down. So if you try and say dehydrate a patient with high blood pressure or give them some medications that suddenly lower the blood pressure and they're a bit dehydrated, the change in pressure is much more marked.
Right.
And that can then cause people to collapse, fall, etc., etc. And that's why you will often see people going in saying, I've been taking high blood pressure and now I've gone in with a fall. And they said, actually, I have low blood pressure. How can that be? And the idea is that it is the very nature of blood pressure to be very variable. And the higher the pressure, the more variable it becomes. The reason I'm talking about all this is because the whole idea is that our blood pressures change all day long. Mm-hmm. And there is this idea that high blood pressure exposes you to bad things happening in the future.
Right.
And so you will go to your doctor and the doctor says, oh my God, your blood pressure is 160/80. Let's do it again. Oh my God, 160/80. You've got high blood pressure. We've got to treat it. You could have a stroke. My question is, when your number changes all day long, which number do you choose to measure against this one gold standard? Which, by the way, changes as well all the time by a bunch of professionals. They'll change the values all day, every year. So which number do you use? Do you use the number in the morning? Do you use your number in the evening? And this is fundamentally the problem. You should only use the number that was used in the study that suggested that if your blood pressure is high, then something bad could happen to you, right?
Right.
But no one uses that number because no one knows what that number is. The answer is that the best number, to my mind, is a 24-hour average. You measure the blood pressure every half an hour during the waking hours, every hour at night, and you calculate an average, and that then takes away a little bit of the peaks and troughs that you would get daily. And then you use that number as your number to compare against this value. So a lot of people don't know their number, right? They're being treated on the basis of isolated numbers, which could be just because they've gone to their doctor and their blood pressure is a bit high, or they're anxious, or they didn't get parking, or something like that. And they're put on medications. And the problem with that is the problem with being put on medications is they will never, ever, ever know after taking a lifetime of medications whether those medications have done anything. Because the reason you're taking the medications is not to lower the number. The reason you're taking the medications is to prevent a heart attack or a stroke or something bad happening to you in the future.
Right.
So you will never know. How would you know? Because you don't know what would have happened if you weren't taking the medications, right?
Right.
So the problem here is that a patient will then get put on a lifetime of medications. His insurance will suffer. He will have the fear of God stuffed inside his head that, oh my God, this could happen, that could happen, that could happen. He starts becoming medicalized. He's going to be put on one medication because his blood pressure is probably to a certain degree just an incidental thing due to anxiety. When he goes again, the doctor will say, oh, we need to increase. So 2 tablets, 3 tablets. And before you know it, here you have a medicalized patient who's paying heavily for his insurance. And the most interesting thing is, when he ends up in a hospital with a heart attack, they'll say, oh, you've got high blood pressure. That was why you've had the heart attack. Well, what were you treating the patient for 10 years? Wasn't that the whole point? Wasn't it the point that you were going to stop the heart attack? That's why you were treating them. So you can see how crazy it is.
Yeah, you get into this chicken or the egg type situation. And this
Exactly.
is what you've said is the exact situation that my father is going through, particularly trying to get this. And one of the things, he gets very anxious when he goes to a doctor. My dad's as tough as nails or whatever. He goes to a hospital, and that's probably the only thing that makes him anxious is when he goes to a hospital or a doctor or whatever. And one of his doctors actually recognized that, because they would look at his daily activity level, which was very excellent for a man at his age. They would run him on the treadmill, and the treadmill seems to be okay. But then he goes in for a thing and has this heart flushing. But then it turned out he had a major blockage in the end that went unnoticed, didn't get picked off. In that thing. And luckily enough, we had some good surgeons that could save his life in the final analysis, which was wonderful. But then now he's back in recovery, and of course they're monitoring it. So if to summarize what you're saying, how would one go about getting these 24-hour kind of tests, doing this regularly? And then how would you submit this to your physician in a way, and what would you kind of lead that towards about working with your physician? Because I always say, hey, if you've got a physician, they've got professional training in a very small area relative to their specialty, and they're to give you expert advice from that position, but you have to give them the data in order to make that decision. And those two so the physician works with the patient in unison. And I think a lot of people don't think of it that way. They don't think of their doctor as I always like to think of the doctor like a barber or a hairstylist. You go in and the guy's like, well, how would you like your hair? Well, do you want it all shaved off? Do you want it with purple? I always defer to my hairstylist. I'm like, well, try to make me look good to the best of your ability, which no one's ever been able to pull it off. But at least I look a little better by their decision. But then they say, is that good? And I'm like, yeah, that's cool. How does someone do this 24-hour thing, and how would they submit that to their physician?
I mean, 24-hour ambulatory blood pressure monitors are widely available.
What's the name of those again?
They're called ambulatory blood pressure monitors. So this is a machine that will automatically record your blood pressure several times during the day. So every half an hour during the day and every hour at night. And the advantage of that is, yes, whilst a lot of people say, well, that would get me really anxious, the reality is you will start seeing this balancing out of the peaks and troughs. That's the first thing. The second thing these things offer is the ability to measure your blood pressure at night. That is a very interesting time, because all the confounders have been taken away. You're not stressed, you're not exercising, this is you get a much cleaner signal when you're asleep. So a lot of people are now beginning to believe that the blood pressure at night, your average blood pressure at night, is perhaps the best predictor of bad events in the future if you have high reading. If you truly have high blood pressure, then generally you lose your circadian pattern with regards to the blood pressure. So most people's blood pressure will dip at night. You know, you can have high blood pressure during the daytime, but if it dips nicely at night, that's a really good sign. It tells you that maybe the confounders are affecting your blood pressure. If it doesn't dip at night, then that's a bad sign. That's telling you that maybe your blood pressure is truly, there's something going on. Remember, when the stretchability starts going, it's going to affect all phases, right? It's going to affect the daytime and the nighttime. So that's an interesting thing. And most doctors have it. The problem is they don't deem it cost effective. They think, oh, well, just treat everyone. It's much easier and it's much more profitable to just choose a number and just hit everyone with it. And actually, some places you're rewarded for getting people, you know, identifying as many people at a certain level and treating them. I think that's the first, how I do it, is I say, well, first let's find out what your number is. Then let's work out whether your numbers are even associated with anything bad happening to you. So now, you know, if you go to America, your blood pressure, if your blood pressure is 130/80, you've got high blood pressure, or if you've got it above that. If you go to Europe, it's 140/90, then you've got high blood pressure. So different people have different definitions. To my mind, the definition of blood pressure is much easier than that, and not one which is so variable. The definition of high blood pressure is that blood pressure which does that person some kind of harm. Because if it's not doing you any harm, it's not high for you.
Right. How do you determine that?
Okay, excellent. So what I would then say is, well, as we said, what does blood pressure, how does it harm? It's about pressure in an enclosed compartment, and therefore, if the pressure is high, the compartment is damaged. So let's look at the most fragile compartments in the body. Where can we directly visualize the most fragile compartments? Well, at the back of the eyes. Okay, you can look at the retina. The retina is full of little blood cells, little blood vessels. These are the tiniest, most fragile blood vessels. So in people with high blood pressure, who have true high blood pressure, you may expect to see little hemorrhages in the back of the eyes. You may start seeing changes within those blood vessels. So I think looking for that is really helpful. One. The second thing I would say is that very small, fine blood vessels exist in your kidneys. And if those start getting damaged, then the kidneys don't do their job. They start leaking out things that they would otherwise be absorbing. And so you can actually measure microscopic amounts of protein in the urine. And this is called microalbuminuria. And that is a very good sign of trying to pick up damage to the kidneys at an early stage. In fact, most doctors use something called creatinine.
Yes.
To assess kidney function. Actually, you could lose a kidney before your creatinine starts going up.
Or you could take a lot of creatine and it can throw your
and that could do that too. Exactly. So I think looking at stuff like that, far more sophisticated. What you're trying to do is offer individualized therapy, individualized treatment. If the eyes are okay, the kidneys are okay, you can look at the heart on an echocardiogram, an ultrasound. The heart is a muscle. If it's working harder, if it's working against a higher pressure, it's going to become more muscular. If the heart is not muscular, you don't have any kidney damage, you don't have any eye damage, then on what basis are we then saying, okay, your pressures are high for you, right? On what basis are we saying that? And if you look at all the data, there are two things which are really interesting. Actually, the analysis shows, all the meta-analyses show that even people with blood pressures of 159/99, who don't have any evidence of damage, if you treat them with medications, all you do is give them side effects. You don't make any difference to their outcomes. Mm-hmm. Okay. And so, again, find out what your number is. look to see whether there is any evidence of damage. Because the reality is there are conditions called masked hypertension where your blood pressure may look normal, but you're still getting damage. In those people, that number is high for you, right? And then the third thing on the basis of that is to then say, okay, well, this is my risk. What is it about my lifestyle that I can address? Because maybe the blood pressure is a symptom of something else.
Right. Like too much hydrogenated corn syrup and fats in your dietary habits.
Or stress or lack of sleep, etc. And in some way, you miss a trick by just shutting down the symptom by giving a person lots of tablets. Look at your lifestyle. Try and become a healthier person. Because when you try and become a healthier person through good nutrition, good exercise, good sleep, minimizing your stress, correcting any nutritional deficiencies, that kind of thing, then you tackle the inflammation, the thing that often manifests with symptoms of blood pressure, etc. This is, to my mind, this is fundamentally important, that we have to understand that we should not mistake symptoms for the disease process. Even if there's a tiny chance that that blood pressure number could be telling you something else, then it surely doesn't make sense to just dumb down that cry for help and in so doing ignore the underlying process. And if you do that, then that underlying process will manifest as something else, like high blood sugars. And then what do? You dump down the blood sugars and the underlying process goes on, and then it will manifest as a heart attack. And that is why so many diabetics and hypertensives go on and have heart attacks despite remaining on medications for 10 years. And the doctor said, well, it's because of your diabetes. Maybe they're not. Maybe the heart attack and diabetes and high blood pressure, etc., are siblings. Maybe it is not that the diabetes and the high blood pressure are parents of the heart attack. I think it's really important. So always it should start off with trying to become a healthier person. And then therapies may give you additional assistance if there is evidence of some kind of damage happening.
This brings up another question, because we've seen so many, what many in the medical field will call anecdotal, unusual research, where you'll see a person, you see the testimonials there, where the guy gets diagnosed, he's 60 pounds overweight, they're in their late 50s and, live a horrible lifestyle. If he goes in, the doctor says, if you keep living this way, you're going to die. One patient goes on to medication, goes through that route, lives another 15, 20 years or whatever. Another person goes and says, no, I don't want to do the medication. I'm going to get into my diet. I'm going to change my diet. I'm going to start exercising regularly. And they get the positive impacts and either delay the day for medication or don't need it altogether. What do you feel is a sufficient amount of time upon doing, say, the analysis that you suggested, and someone making, hey, I'm going to make some lifestyle changes here to kind of move forward? What is a sufficient amount of time do you feel on, and I guess we're generalizing here a little bit, but for people to see positive benefits from their dietary and lifestyle changes, that you could say, okay, we've got a new, quote unquote, a new normal for that person? What have you noticed?
I usually give my patients 3 months.
3 months. That seems to be about right. 12 weeks.
I say to them, this is your chance. Your body's trying to do something. And after 3 months, if they haven't managed to engage, then in all likelihood, they're not going to. That this is the fundamental, right. If they're not going to, they're not going to. Well, then a lot of times you just do the thing that you're supposed to do as a doctor because you don't want to be seen as an outlier. You don't want to get into trouble. You don't want, a lot of what we do is largely about keeping ourselves safe, really, protecting ourselves. We're not that bothered about the patient.
Right, yeah. First, do no harm, but also don't get anything that gets you a lawsuit and shuts down your practice, a harm to your own business as well. And here's the thing, but it's we have to give both sides of that equation as well, because I think we'd be remiss if we didn't identify and suggest that, hey, the doctor is in a difficult position as well. You obviously, with your genetics and your lifestyle choices, you're putting a disproportionate amount of responsibility on this person to get your life right. And why shouldn't he or she protect himself somewhat from your inability to manage your life? And so I don't think it's fair to just dump it all on the doctor and say, well, he's protecting himself. Well, of course he is. And for most doctors, they would probably say that, 9 out of 10 patients don't make the lifestyle adjustments. But what you're talking about, I think, is inviting people to say, hey, take the time to make the lifestyle adjustments. And then before making that step into, getting on the various pills. And if after 3 months of lifestyle adjustments is not enough, okay, well, maybe that's the right choice for you. Would that be a fair assessment?
Absolutely. I think patients, you need to sit down with patients. You need to talk to them in a language they can understand. You need to be able to show them what it is. Ultimately, you need them to see what the data show, right? You need them to understand their individualized risk. You need to show them that, okay, this is what I'm picking up here. And then they go and do that. But if you have 5 minutes with the doctor and he says, okay, you need to go and exercise and lose some weight, it's difficult for the patient to take that.
Mm-hmm.
When a patient is just told, okay, here, you've got to take these tablets, in some way you've missed that opportunity to really engage with that patient and really let him feel empowered. This is the most important thing. In fact, I did a video on blood pressure, and I got a professor from the US right really scathingly, and he said, how can you say this? Do you not know that for every decade of life, if your blood pressure is above this, it doubles your risk of something bad happening to you? And I said, that's fine. That's okay. But first tell me what my risk is before you talk about how it could be doubled.
Right.
Because in some ways, it's a bit like going and buying a lottery ticket. Okay, you buy 2, you double your chances of winning the lottery.
Mm-hmm.
I've got to know what my risk is first. And that, I think, no one tells you.
Yes. And I think there is a disproportionate amount of focus on the risk. I mean, at the end of the day, life is a risky business that we all lose the bet. Sooner or later, the body battery runs out and you go out from one thing. And one of the suggestions I had, and this was one of the arguments I was putting forth with one of my doctors recently. I said, hey, look, call me a Neanderthal, but I believe it's not necessarily how I'm going to die. That's the issue. It's how I'm going to live until that moment that is of more concern to me. And I put the onus of responsibility on myself to go out there. And I'm engaging in this 50-week process. So I started it this week, 50 weeks to 50. I turn 50 next year. I'm very excited about the prospect. And I said, okay, well, I'm actually going to document and show week by week everything. I've hired a bunch of coaches for myself to give me insight on different areas. I got hormone testing and blood testing and genetic testing, and I get my fitness coach. And even though I'm well versed in all of these areas, I know that it's very hard to overcome one's own biases or one's own tendencies to let oneself off the hook. But if you have people there that are kind of giving you the gears a little bit, particularly if they are a much better expert than myself in that area, I think it's very helpful to kind of stack the deck against lethargy or rationalizations of behavior. Would you agree with that?
I agree. I mean, I think it's nice to have something to measure yourself by. The reality is, all we want to do is live as long as possible and live as well as possible, right? Mm-hmm. And actually, we have no control over how long we're going to live. We could do all those things, and we could be happy that our cholesterol is fine, and then we can be hit by a virus or something like that. We have no control over our length of life, and I think that is so important, because this idea and trying to get that out in an empathic way is so important. This idea that the only thing you have any control over is your quality of life, and actually that is the only thing that matters. When you will never be able to measure your length of life. Anyone who comes and tells you, oh, I'm going to make you live longer, you will never be able to work out whether that claim is correct or not. Because you just get the one life. You can't do the test and say, okay, well, I followed him and I lived longer than when I didn't, right? So the only thing you can measure is your quality of life. You cannot measure your own length of life. And so I think a lot of quality of life comes from, personal investment, you investing in yourself, you being creative, you spending time with people you love. That is what quality of life is about. And growth, personal growth, whatever that may be, that is so important. Unfortunately, in the Western world, we're expected to stretch. We're not expected to grow. We stretch, we don't grow.
Can you define the difference between those?
So, when growth is about you investing in yourself and you are rising to a point where you can look at yourself and say, well, my investment has actually lifted me in some way. Whereas a lot of times in places you would be said, okay, if you work hard, you'll become the boss, or you'll become this, etc. And actually what that means is you'll do everything else and you'll just get a lot more work, and you'll be able to stretch and just have to try and incorporate this. That's not real growth to my mind. Growth comes from that kind of, growth is inherently very nourishing, I think, whereas a lot of us, we try and incorporate lots of different things, and we're literally just stretching to try and cover everything that we're expected to do. And I think that's where stress comes from. And I think stress is something that not only impacts very badly on our quality of life, but also probably our length of life. So I think that this idea, trying to get this idea across to people, that there is no, medicine is no dark art, that where we know so much more than normal people. I think good medicine is not about what we're doing at the moment, which is we are enslaving people. You can't eat this, this will happen. You can't do this, this will happen. Your blood pressure is too high, we need to lower this. I think good medicine is about liberating people. I think good medicine is about saying, go out there and have the best quality of life you can. If things work out for you, great. We're going to be with you rejoicing. If things don't work out for you, we're going to be here to try and patch you up, because that's what we do. We patch things up. We don't stop people from breaking. No one does. If you're going to break, you're going to break. But you maintaining a good quality of life, looking after your health, allows us to patch you up much easier, like with your dad. He did everything right, yet he's got the coronary disease, remained fit, etc., etc. There is no magic solution to that. If you're going to, that's dependent on age, genetics, bad luck, lifestyle, etc. Unfortunately, the only thing we have any control over is lifestyle.
And there's considerable evidence that if my dad hadn't been in the condition that he was, he might not have been able to even initiate or survive the surgery itself, or even get to the surgery point. So, again, we're back to that moot point. But I think all the evidence points that investing in a high quality life, and really determining what a high quality life is, both in wealth and maybe accommodate, like career ambitions, self-development, your relationships, and that mathematical algorithm is going to be a little bit different for different people based on their psychology and their personality and what's important and value to them. And I know I'm a big fan of psychological testing. about understanding oneself. There's some great book series out there by Jordan Peterson right now on the self-authoring suite, where you go through your life and you determine your 5 major personality traits, and then you kind of write out, you know, what your past is, what your present is, and you take a laundry list of the things you like to work out, and then what would you like to be like. And I think by laying out, if we teach people those methods and recognizing that some people are artists and some people are scientists, some people are social, some people are not so social, but if you understand yourself and cultivate that practice for yourself, that's fantastic and a great way to live. Before we close, I would like to invite you to share maybe what are the things that you believe for yourself, or what you've seen with your patients, because you're in a unique position where oftentimes, I suppose, patients are coming to you when life has gotten away from them and they're on the back 9, I would say, or the last few holes of the course. How would you define quality of life for people, knowing where they end up near the end of it or when it's been compromised? I think that puts you in a very interesting position.
Yeah, I mean, I think the most important thing is I think the most important thing from my perspective is that you have to understand that there are always options in life. You don't have to, it's never a case of you don't have a choice. It's how uncomfortable you feel about thinking of something else as an option. But there are always options. And it is about you choosing to take those. Firstly, being able to see those, and then secondly, being brave enough to take those. And as a doctor, what I find is this ability, or this, I find it very empowering for myself, enriching for myself, to be able to show those options to patients and saying, look, you know, this is your life. I'm not here to tell you to do this or that. This is your life. But all I want you to know is it's not like I will stop supporting you or stop wanting to help you if you chose something that doesn't work out for you. That's okay, because at the end of the day, that's what it's about, you know. And I think we should listen to people. And I think personally, I find that in my consultations, the thing that I have realized more than anything else is that all people want, all medicine is one person coming to another, wanting to be treated like a human being, and more importantly, by a human being. And that humanity is what it's all about, right? It makes everything go around. Bad things happen, and it's the humanity that makes it bearable. Yet at this point in time, what we find is that people feel so incredibly isolated. And you don't go and see another human being. You go and see a robot. You go and see someone who regurgitates jargon, who regurgitates guidelines, who tells you this thing could happen, that thing could happen, who doesn't have time for you. I think empathy, education, engagement, empowerment, I think that beats every set of pills I've ever prescribed. And as a doctor, I think that that's what I can give patients. And I think their quality of life improves as a result of that.
Beautifully said. And I love how clear you are about those things. And I do believe that is potentially where the future of real healthcare will be, is fusing the greatest scientific stuff, but not using fear and emotionality or a mathematical algorithm to determine, to dehumanize the experience. And Dr. Gupta, I know you're a big fan favorite with our audience, and they're going to love this interview as always. It's so nice to be able to see the empathy and care that you obviously embody in your work, and taking the time to share with us on the Awesome Health Podcast. Thanks so much for joining us today. And for all our listeners, if you'd like to find out more about Dr. Gupta and his work, can you kind of give us all the social media things, or where you can follow?
Yeah, thank you. I run a channel called Your Cardiology, which is based around where I work. And it just at that time seemed like a good idea to capitalize on York and cardiology. Yeah, I know we share some viewers, and I'm very grateful to be invited here. I think you do amazing. It's seldom I come across people who are so incredibly educated and so open and so easy to talk to. As a healthcare professional, I feel very comfortable talking to you, and I feel that I really enjoyed it. Thank you for having me.
Well, thank you so much. And we'll put all the catch points in the show notes, some of the references. And of course, as Dr. Gupta said, it's about quality of life, and you always have choices. So make the right choices for you. That's another edition of the Awesome Health Podcast. I'm Waiti Lightheart from Bioptimizers. Thanks so much for joining us. If you like this, hit the like button, smash it, share it, and we appreciate all your feedback and comments. Thanks so much. Take care.
And now for a Bioptimizers fixed digestion tip. Turn cultured foods into superfoods. Raw fermented foods like sauerkraut and low sugar, live yogurt can be good for you, but rarely have enough of the right probiotic strains for therapeutic benefit. So here's a way that you can turn them into superfoods. What I do is I get some raw sauerkraut or a healthy yogurt. Ideally, it's grass-fed or coconut-based, and you can empty 3 caps of P3OM into a container and mix it up thoroughly. Leave it at room temperature for a couple of hours before putting it back into the fridge. And what's going to happen is these probiotic levels will be multiplied. In fact, it doubles every 20 minutes. And then what you're going to get is you're going to have a food with strong proteolytic activity. To learn more about P3OM and why its patented strains make it the strongest probiotic available, go to www.bioptimizers.com.
Thank you for listening to the Bioptimizers Awesome Health Podcast. You can find more information at bioptimizers.com.